recognize what these workers do, is to see their hard work and how hard it is for them to make ends meet, because these are tiring, taxing jobs, even before coronavirus came.
As society largely shuts down.
Hi, Abigail. This is Cameron from Uber Eats. If I keep getting delivery requests, I'll keep going. No, I mean, I'm aware of the risks, and I take my precautions.
It's become clear which jobs are truly critical.
At least 5 employees at supermarket chains all across the country have died from the virus.
Some days where I've had severe anxiety. In my profession, I have no idea what I'm walking into. I don't know if the customers are carriers.
But as these often undervalued workers keep society stitched together, will our newfound reverence bring lasting change?
Do they worry about you?
Yes, but they know a lot of people want to be here now because they don't have another option. How can we help you?
Top local story. It's continuing in-depth team coverage of the coronavirus crisis. It's a stay-at-home order for all of California.
The governor said as many as 25 million Californians could be infected over the next 8 weeks.
So people have been told they have to stay home, but they can go out if necessary to buy groceries, go to the drug.
This week of what is the worst week since the financial crisis of 2008.
Those of us who have jobs right now, we're really fortunate. Hourly workers and people in the gig economy, they don't have the safety nets.
The governor says the stay-at-home order is in effect indefinitely.
The emptiness is just unreal. Never seen anything like this.
Los Angeles is infamous for its gridlock traffic, but many LA residents, especially those in low-wage jobs, depend on the bus system to get to work.
So you need the bus to get around. Do you work?
Yep.
You do work. May I ask what you do?
Waiter.
Oh, you are? Okay, so you're doing pickups now?
Yeah.
So you work at a restaurant?
Yeah.
How is business?
Slow down.
Yeah.
A lot of people prefer to stay home.
Yeah. People feel safer at home.
Yeah.
So business at the restaurant is slow. How are you doing? Are you okay?
I'm really okay because I hope that it won't last this too long, like a month, or maybe last with 2 months. A lot, not only me, but a lot of people gonna get problem.
Yeah. Are you getting off here?
Yeah.
All right. I'm gonna get out of your way so that we stay away from each other.
Thank you.
May I ask, what do you do for a living?
I'm a contact center representative for Molina Healthcare.
Okay, so you're still working?
Yeah, I'm still working from home now. Yeah, I work one of the lucky ones.
Yeah.
I mean, I have close people to me that are lost their jobs, so it's very unfortunate.
Yeah. So normally you would commute on the bus, but now that you're working from home, you don't really have to use the bus that often, or?
I still do. I still get around. I try to be careful, but definitely I'm still out there. I probably shouldn't be, but yeah.
Shopping and running errands and stuff?
Get food, just whatever we may need daily.
Yeah. What would you do if the bus services stopped?
That'd be horrible. Yeah.
Well,
I don't think we could deal with that.
Yeah.
For safety, we had to wait until the bus driver wasn't behind the wheel to speak to him.
Ridership is down. The stay-at-home order has affected the ridership, and it's really, really light.
Though there's been a drop, there are still people who rely on the bus.
Absolutely. We take a lot of people who are hospital workers, who are actually restaurant servers, who actually do the to-goes. We do a lot of people like construction workers. The construction is still going on, so we got a lot of construction workers too.
Do you feel at all nervous, anxious about what you do?
I feel honored and privileged to be out here when so many people are out of work, and now they've called us disaster relief operators. And it's funny because that's actually written on the back of our IDs. It says disaster relief workers. We never implemented that because we never had a disaster.
Right.
So now a CEO reminded everybody that we are disaster relief workers.
This is the bus depot in downtown Los Angeles, and from here, these buses fan out across LA. Being from Los Angeles, I can count on one hand the number of times I've been on a bus as an adult. but it's become painfully clear just how essential mass transit is, even in a city of private automobiles. Without these buses and without these bus drivers performing their duties, a lot of the other essential workers, the grocery store workers, the restaurant workers, the healthcare workers wouldn't be able to get to and from work. And so these buses are really a vital cog in the infrastructure that is keeping society moving.
¿Puede agarrar su carrito ahí? Ahí hay desinfectante adentro, por favor.
Muchas gracias.
Hi, how are you guys? Morning.
In California, the average non-management grocery store employee makes less than $30,000 per year, but in the midst of this crisis, have become irreplaceable members of the workforce.
Hello. How are you guys?
Good, how are you?
Is doing okay? Good. Este lado, señor. Tenemos la 2 y la 1.
So what are some of the safety protocols that you've introduced?
So what we've introduced is, first of all, frequent hand washing, at least 20 seconds. Also, deep cleaning every hour. And at night, extreme deep cleaning. We also make sure that nobody is sick that's working. And we're really strict on gloves. If you're in a prepared foods department, if you're a cashier, a courtesy clerk, you're using gloves.
Have any of the staff expressed fear or anxiety about coming to work?
Sure, and that's part of the leadership piece that we have to provide, right? Help them through their questions. We want to do everything for them to feel comfortable and make sure that they're our top priority of safety and then our customers. Paper towels, Pepe? How are you doing?
How important is it for the store to remain open?
It's very important. Not only is it important for our team members, but it's important for our community. Everybody's at home? You got the kids at home? You know, there's people that have purchased their groceries at Northgate for 40 years. You know, they've come to our stores every single week, and that's just the way that they feed their families. So if we're not here, you know, we would think, you know, where are they going to go?
Oh, okay.
Thank you, Mando. There you go, Pepe.
Thanks, Armando.
Did you ever think that you and your associates would find yourselves at the front line?
No, I never thought that this would be this type of situation, but I do see it as a blessing that, you know, we have the opportunity to serve. You know, the opportunity, just like police, like doctors, we have the opportunity to bring something valuable to the community, and that feels good.
On the day of filming, the Centers for Disease Control reported over 68,000 cases of COVID-19 across the U.S. Within the next 4 days, the number more than doubled.
Hello, you need some help over here? Give me a minute, I'm with you in a second. Anything else?
So you've been working here for 6 years.
Yes.
So tell me a little bit about your story. Where are you from originally?
I born in Mexico City. I live my whole life in that city, and I changed my life when I came here. I was a teacher. I work in something really different now, but the work is important.
A lot of us who have the option of staying home,
Yeah.
you know, for me, I'm staying home all day. The one time I go leave my place is to come to the supermarket, and I have to say, it makes me nervous.
Yes.
Are there times when it's a little scary for you?
I think it's hard, but we are trying to take everything one day at a time, and the sanitation or cleaning as much as we can all the time. And that is one of the things that make us feel a little bit safer in that place. Yeah.
If you had the choice, though, would you stay home?
Maybe, yeah. So we have some that they choose to be home. I think a lot of people want to be here now because they don't have another option of work now.
California is one of only 12 states that requires employers to offer paid sick leave, 1 hour for every 30 hours worked. And they're allowed to cap it at 6 days per year.
I have concerns. One's livelihood is always a concern, even during boom times.
Cameron, who preferred we not use his last name, delivers food for Uber Eats and Postmates, but like all delivery app couriers, is considered self-employed.
So dropping this Panda Express off, which I'm going to do in just a moment, I think it's probably going to pay maybe $2.94 before tip. But people generally do tip with Postmates. So if I did 10 of those over the course of 4 hours, that would be like $25 off. There's a base, no matter what it is, you get paid an amount for the pickup and for the drop off. So you're guaranteed a certain amount. And of course it goes up the longer distance you drive. Hi, Abigail. This is Cameron from Uber Eats. I like to say I have a Midwest work ethic with a California sensibility. I want to be working. I take pride in my work.
Yeah. Part of the reason business overall seems to be up for these food delivery apps is people are afraid to get out. Are you afraid to be out?
No. I mean, I have concerns. I mean, just as much as everybody else does. Yeah, I mean, it might seem I have a cavalier attitude, but no, I mean, I'm aware of the risks and I take my precautions.
Given how important your role is for all of us, especially now, do you feel like you're being adequately compensated?
I mean, I'm a bit of a stoic in that regard, in ever saying that I'm not getting compensated enough for something that, I'm ultimately choosing to do it. Earlier this week, I got an email from the CEO of Uber saying that he wrote a letter to the president to please include independent contractors and Uber drivers such as myself in the stimulus package. I kind of think Uber could probably do that themselves.
Sounds like passing the buck.
A little bit. Passing the buck to somebody who's already passing the buck, so.
Do you feel like people, who are essentially on the front lines like you are, should be getting like a hazard pay of some sort? Because I'll tell you, there are a lot of people who probably wouldn't feel comfortable doing what you do.
That's true. But then you can also ultimately make the argument that I'm choosing to do this.
But are you?
I am. I mean, like I said, I'm an independent contractor.
Right.
I'm not a nurse, I'm not a healthcare worker. I don't have the same moral obligation to keep showing up and doing this.
But you certainly have an economic obligation to yourself, to anyone who depends on you.
Right.
Bills aren't going to stop showing up.
No, they're not. Which I think that then goes back to the initial argument for just a higher rate of pay to begin with.
As critical workers continue to be exposed to people and places, the stakes continue to rise along with the number of cases. And now some have paid the ultimate price.
At least 5 employees at supermarket chains all across the country have died from the virus.
48-year-old Thomas, who'd worked for Walmart for 9 years, died 2 days after calling an ambulance for himself after struggling to stand up.
Her name, Leilani Jordan. She kept working at a Maryland supermarket despite the risk, telling her family the store's older customers needed her help and she needed to be there.
And they put her in isolation, and she called me. She says, "Mommy, I can barely breathe."
I kind of brought my crazy bag from work with me. This is my cell phone. This is my drink, how I take it into work. This is basically kind of like my new purse. I actually left the purse in the car, but this is all the stuff I want to bring into work when I come to work.
Sandy, who asked that her last name not be used, or the name of her employer, is one of a minority of grocery store employees that belongs to a union.
Some days where I've had severe anxiety, I almost felt like I was, couldn't breathe, and I was just literally counting the minutes till I could go punch out and at least take it off and get some air. I mean, healthcare workers and doctors and nurses is a much dangerous position, but sometimes I think they know what they're walking into. They know they're walking into the room with a sick patient or potentially sick patient. In my profession, I have no idea what I'm walking into. I don't know if the customers are carriers or not carriers or potential carriers. So, I just try to be safety first. you know, whatever I can do to keep myself safe and also keep, you know, them safe, because they're going to depend on me as well as I depend on them. So,
given all that's happening, do you consider your workplace a hazardous place to be?
Considering the nature of what's going on, yes, I do consider it a hazardous place to be.
And are you getting any protections or benefits from that?
So far, the protection that I've been using, we did have some gloves initially. We normally use them for taking out the trash, or maybe when we're cleaning and sanitizing a check stand, but we don't normally wear gloves on a day-to-day basis while we're checking. And initially we had some gloves, and I did warn my coworkers. I went and bought some gloves myself, and I told them when the gloves run out, I'm not sure what's gonna happen.
So a lot of people like you who were sort of unwittingly dropped into the front line.
Mm-hmm.
Do you get any hazard pay?
As it stands now, they're letting us know that we are gonna get hazard pay. We just got notification of that. That's starting March 28th to, I think, April 5th, and it would be $2 more an hour for hazard pay. Anybody working overtime would get $3 more an hour, and that will be for that time frame. And then they said that we're going to go from there, and they'll let us know if we're going to continue to get hazard pay. But as of up to now, we haven't received hazard pay as of yet. They originally had offered us a bonus instead of the hazard pay, and at this point they've decided they're going to give us both. So they've offered a $300 bonus for full-time members and a $150 bonus for part-time members.
It seems pretty meager
So-
for what you're going through.
Correct.
Doesn't seem like it's worth the risk that you endure every day.
You're absolutely right. It's probably not worth the risk, but unfortunately, you know, myself included, a lot of the people in the grocery industry need to continue to go to work to provide for their family. And to be honest, my husband's not very well, and we depend on my medical benefits. So I don't have a choice. You know, my bills need to be paid. I don't have a choice. I have a daughter in college, and that we're paying most all the expenses for that. So I don't want to let her down. I don't have a choice right now. So
What is it that you want from the company?
I'd say from the company, just more protection for us. That's all. Don't even have to treat us like heroes. Maybe gloves every day, a mask every day, you know, making sure the hand washing stations are ready and available every day. So just simple stuff like that.
The American people deserve a government-wide, visionary, evidence-based response to address these threats.
Congress recently passed the Coronavirus Aid, Relief, and Economic Security Act. While it will offer assistance to millions of Americans, including many independent contractors, loopholes in the law could also end up excluding some gig economy and self-employed workers.
This all totals up to $1,331.
One supporter of the bill gained attention recently as she fought for free coronavirus testing nationwide.
So my answer is yes.
Excellent. Everybody in America hear that. You are eligible to go get tested for coronavirus and have that covered regardless of insurance.
Hi, this is Congresswoman Katie Porter.
Hi, this is Adam Yamaguchi with CBS.
Okay, you should have my video on now.
I do, and do you see me now?
I do.
Great. Well, thank you so much for taking the time. This is sort of an unusual arrangement. I'm actually in a park right now because I have my crew filming, and we don't want to be indoors together. So we are, talking to and profiling a few people who work in jobs that have, in recent days, sort of been deemed as essential work. We're talking about bus drivers, we're talking about grocery store workers and delivery drivers who, let's face it, if not for the services that they provide, I think a lot more of us would be freaking out. Can you talk a little bit about what you have done to push for, whether it's better pay or better working conditions for these folks?
Here's a couple things I'm really focused on to help essential workers. One is when Congress passed the Families First Act, and then now this, what we call the third bill, the CARES Act, we did not mandate that the nation's largest employers provide paid sick leave to all workers. And yet, Who's staying open during this pandemic? Who's staying open are the big retail grocery chains. But yet Congress did not mandate paid sick leave for employers with more than 500 employees. And we should. And we need to call on those businesses to step up and provide paid sick leave, not just for some of their workforce, not just for managers, but for all of their workforce, including the contract workers that they use and rely on.
Right.
The second thing I'm really focused on for essential workers is what are the right guidance, what's the right guidance and what are the right standards to keep those workers safe? For people who are working in grocery stores, they don't even know what they're supposed to be wearing. I heard the story today about a pharmacy in Orange County, part of a large chain, that was giving their workers who deliver life-saving medication to pharmacies one pair of gloves to use for the week.
Wow.
For the week. It's a hodgepodge across different employers, different kinds of work. What one company's doing is not what another company's doing. And so we're not even able to identify, I think, what are the best practices here, much less enforce those. That's the job of OSHA. That's the job of the president's administration, and they need to step up and do it. To be clear, there's no good justification for allowing large employers to skate by doing less to protect their workers. The only explanation for that is the terrible influence of money in politics and the effect of lobbying by huge corporations. To recognize what these workers do is to see their hard work and how hard it is for them to make ends meet every single day, not just during a pandemic, because these are hard, tiring, taxing jobs, even before coronavirus came.
It's a sanitizing solution that we get from the cleaning distribution company. So we use it for cleaning down the carts, cleaning anything that customers touch, basically, just so we start off the day pretty clean. This is something that we always have. Now they're more frequent on it.
Ok, solo quería saber, estaba... No te preocupes. Acá te veo, bye.
Do you have kids?
Yes, I have 4 kids.
Do they worry about you?
Yes, some days ago they were telling me that why I don't stay with them in the house. They ask, but they know too that we need to work, yeah.
But do you ever worry, what if I catch it? Because I'm coming across hundreds of people every day.
Well, in the house we are taking a lot of measures. My 6-year-old son is hard because he's very huggy and
kids, right?
So yeah, but I'm trying to take some distance with them. Yeah, I go and take my shower and change my clothes and leave my shoes outside, and I am worried about them.
You know, after all of this is over, after life goes back to normal, whatever that may look like, do you think America will remember the work and the contributions that people like you made to society?
I hope that they do. I think always we have soldiers and people in the army that give their lives for this country. I don't feel like a soldier, but I'm trying to do my best for the community, for my people that work with me every day, and for my family too. I can give this country to the most that I can. How can we help you?
You know, I hate to sound like a cynic, but if we can't recognize as a society right now in the middle of this pandemic what essential work is being done at great risk to the people performing it, if we're already having this much trouble extending certain benefits and protections and rights to them, when will it ever happen?
Yeah, no, I think this is right. We have to use this moment to make sure that those people's needs are met, and that they're met not just during this pandemic, but that they're met on a permanent basis. So, like I said, paid sick leave is not just good pandemic policy, it's good public policy. We have to be willing to change policy on a permanent basis to recognize and honor these workers.
I have no doubt in my mind that I have delivered a delicious meal to somebody who's sick of whatever's in their cupboard, who has been told by their doctor to self-isolate for 14 days. And I'm making their day a little better.
Thank you.
Oh, you're welcome. So Uber Eats for Giovanni Q.
There we go.
Yeah. I got just a molcajete de asada. Mild. All right, thank you. 3 minutes and 0.8 miles away. You know, it's fairly busy depending on the area, but you know, I'll probably do 8 to 10 more deliveries, depending. If I keep getting delivery requests, I'll keep going. You know, I can see myself being done at 10, I can see myself being done at midnight. Sometimes it's shopping for people. They'll go into Walgreens and buy deodorant. Last week I brought the day after pill. And yeah, I brought the morning after pill to somebody who was spending a little too much time at home, I guess.